It's Dr. Parikh here doing a reverse tummy tuck, guys. Here, patient has a lot of excess skin above the belly button, but not enough below, and that's a candidate for the reverse. As well as, look how wide the implants are. Here's the cleavage. You want to bring them in. We're doing an implant exchange, no lift here, with the combination incision with the reverse tummy tuck. Dr. Parikh here, did an implant exchange here. She had a lot of cleavage. We brought that in, switched it to a little bigger saline to silicone deflated salines with a reverse tummy tuck, guys. Here, that's where we make an incision up here instead of down traditionally by the lower abdomen here. The belly button usually has this kind of configuration here. And you can see here, we pull that up like this, then remove that extra skin here. So wrinkling that's above the belly button, this takes care of that quite a bit. We also plicated the muscle here from the belly button up if you need it. And we're gonna remove all that extra skin, and that's gonna make a big difference. Hey, it's Dr. Parikh, just finished a reverse tummy tuck, implant exchange, saline to silicone, higher profile, a lot more upper pole, had the deflated salines, went up in size as well. Brought that cleavage, which was from here down to here. Amazing with the capsulorrhaphy. Reverse tummy tuck, guys. This belly button there's a lot of loose skin in the upper abdomen. Pretty tight now up top here. Raising that up, muscle plication in the middle. We're all